The DVT ultrasound exam in ED is used predominantly to look for above-knee deep vein thrombosis.
The patient position is supine with the leg externally rotated and abducted. Use the linear probe with vascular setting. Most ultrasound machines will let you use a dual screen mode, which lets you show the difference between a compressible and non-compressible vein. Start by finding the common femoral vein with the probe marker pointing to 9 o'clock on the clock face. This is right next to the common femoral artery and slightly medial to it. Check that the veins compress with medium pressure. They should be able to fully compress, whereas the artery stays pulsatile and isn't fully compressed. Save an image to show that the vein is compressible. The DVT ultrasound technique involves just sliding down. Next, we find the junction of the great saphenous vein coming off the common femoral vein. You want to show that this junction also is fully compressible and there is no DVT here. If there is a DVT, the vein is not compressible. The process of the DVT ultrasound is simply to go down every centimeter and compress the vein fully, follow the vein down, and look for signs of non-compressibility. You should be able to compress the vein, and normally we would check interval compressions every 1 centimeter down the leg. Follow the femoral vein down and continue to compress the vein, and as you go down distally towards the more distal part of the leg, you will notice that the femoral vein gets deeper and deeper. After saving an image of compressible vein at the common femoral vein and the great saphenous vein, about halfway down, save an image of the femoral vein before it dips into the adductor canal. Measuring at least 3-point measurement, including the common femoral vein, and popliteal vein, has been shown to be highly sensitive for picking up DVTs. As you get more distal, it can be hard to find the vein, and 2 techniques you can use are to put your other hand behind the patient's leg and push up, or move on to the popliteal vein and move proximally from there. Identify the popliteal vein and the popliteal artery and check here to complete your above-knee DVT ultrasound exam that the popliteal vein is compressible. The vein should be superficial to the artery in this technique. It is important to ensure you have adequate views throughout the above-knee DVT scan to exclude DVT. If you cannot see the whole vein, you cannot exclude a DVT.
This completes the DVT ultrasound exam.